Still on health-related issues though, with about 100 cases of burns recorded at the burns unit of the Korle-Bu Teaching Hospital, children make up between 60 to 70% of the cases. In this report by my colleague Ikwia Oforiwa Dako, the rise in burns cases at the Korle-Bu Teaching Hospital is becoming alarming, requiring the urgent need to enhance the expertise of healthcare professionals in managing burns and reconstructive surgery cases in the country.
Having been admitted for about 10 days at the burns unit of the Korle-Bu Teaching Hospital, a 3-year-old referred from the Volta region is battling for survival after falling into hot water. His mother, Esther, recounts what led to her son's current state and how his referral has become both a financial and emotional burden, coupled with the pain her son is enduring.
He was playing with the elder brother and accidentally fell into the water. So it's never been easy at all. Very stressful, sleepless nights. If they can establish burns units in other regions, Volta, we don't have any. So we'll be very glad if one is being put up there so that we will not have to travel all the way to this place.
Sarah Tago's 3.5-year-old is also suffering from multiple degrees of burns. She said her son's deep burn is traumatic and the cost of treatment is also taking a toll on her family.
I was drying clothes when I heard a noise from the room that he and her sister was crying. So I rushed inside and I found out that they were fighting. The sister is the eldest. She said this one pushed her first, and she pushed him, and he fell in the stew of pot fire. When they were washing it in the emergency, I can't stand it. It was painful the way he was crying, and even the cost.
A 13-year-old, also admitted to the burns unit at Korle-Bu, is recovering from total surface burns caused by using a highly inflammable product, hand sanitizer, to light coal fire. Burn injuries among children have emerged as a significant global public health concern. During a routine checkup at the burns unit, the news team engaged the Deputy Chief Nursing Officer of the burns unit at the Korle-Bu Teaching Hospital, Safwa Ompong, about the rise in pediatric burn cases.
Some are negligence on the part of the parents, and some children are very curious, so they are always fidgeting with everything they find. They are always going around looking for other means just to play. And if your eyes leave them just small, then you see them going wayward. So most of the children come here.
She said scald burns from hot water and food were the primary causes of pediatric burns in the country.
I've also seen most of the burns that we get from the children is also from hot water. Why hot water? Why should hot water kill children? That is what somebody might ask. And I don't think it should. Because if we should get 30 children in a month, 20 is hot water, which is very alarming. And we don't think those things should happen.
Handling burns, especially at home, without effective first aid, could increase the extent of damage to the body.
One thing that we don't know is the first aid. If parents know first aid management of burns, at least as soon as the child pours the hot water, they know what to do. If the first aid management is done well, the burns will not become big. Like somebody will say, a small burn will become a small burn.
As one of the busiest centers at the Korle-Bu Teaching Hospital, the National Reconstructive Plastic Surgery and Burns Center treats all types of burns, particularly severe cases, traumas and ulcers. Due to the critical nature of burn management, the second and third cohorts of nurses from across the country and other parts of Africa have been trained in a 1-year modular program at Korle-Bu Teaching Hospital to manage burns and make critical decisions related to plastic and reconstructive surgery.
For plastic surgery, when you get an accident and it's a deep burn, which we learned, when you come over to plastic surgery, you have grafts a surgical graft, which we call split skin graft. We have other types of grafts, so I'm mentioning just this, and we use it to cover the wounds.
I wanted to know what burns is all about. So with the course, we learned about what causes burns and the various stages of injuries that comes with burns and what type of patients wouldn't need surgical interventions.
The director of the National Reconstructive Plastic Surgery and Burns Center at Korle-Bu, Dr. Poma, said that without nurses, no specialty can advance. The center introduced the one-year comprehensive training program to help advance burn care.
We felt that then we have to do something about the lack of specialist expertise in the area of nursing when it comes to burns and plastic surgery, because you go to theater, go and perform a complex operation. If the nurses are not the same level to appreciate how to handle the patient, then all your work is not going to yield any good outcome. And so we decided to look for means to get this course on board.
Globally, burn injuries have been identified as a leading cause of morbidity and death among children. There are approximately 1,500 severe burn cases in Ghana annually, and a significant fraction of these burns occur during large-scale disasters. Ekia Ofreyiwa, Dakon, TV3 News, Accra.